And good morning, I'm Dr. Deuk. It's September 2nd, 2020. I'm here with one of my patients who, everyone thinks I just do laser surgeries, endoscopic spine surgery, but I actually do fusions too. And this gentleman had a fusion and he's agreed to kind of share a little bit about his story. Why did you have a fusion done on your neck, a cervical spine fusion?
Basically my left side was completely numb. I don't feel nothing. I used to get hit with hammers, construction working. I don't feel nothing. And one day my back started, like my neck basically was getting pinched. And the pain was so bad, it was ridiculous. And basically when you do the surgery, I feel everything now. I don't feel this for close to 15 years.
So for 15 years you were getting more numbness in your left arm.
Correct.
And then you started having a lot of pain in the neck down the
Yep.
arm. And then you came to me, we got an MRI, we found a
Correct.
pinched nerve from a herniated disc,
Yep.
and we did fusion.
Yep.
A decompression infusion called an
And
ACDF.
from now, basically, I feel good again.
Your arms, you can feel your arm
I
again.
feel my arm, my
Yeah.
leg, because part also was my leg.
Yeah, because your spinal cord was getting pushed on. So he had a myelopathy and a radiculopathy. Now when I first came in this morning, he was angry with me. Why were you angry with me?
Because now I can feel every pain.
Yeah, so when he hits the finger instead of the nail with his hammer, he feels it and he's angry with me. You need to work on your aim, right?
now.
No,
Yep.
don't get angry with me. That's your fault.
But definitely, I appreciate it.
You're welcome.
I say 15 years, but it probably was more than that. I used to get hit. I don't feel nothing. Now, basically, I feel normal.
Good. And if you could have done the surgery sooner, would you have done it sooner?
Yes.
You knew about it?
Basically, yes, because all these years I didn't even know what was going on with me.
Yeah.
Till now.
So nobody diagnosed you properly until we
basically everything, take this, take that,
Pills.
narcotics,
Yeah.
and be high. That's basically what they do.
And are you happier now that you're not high? That you're actually your
Yes,
brain's
basically
working?
I don't taking pills. I'm doing my regular therapies. I'm working again,
Good.
and I'm doing a little bit more, but the age is hitting.
Yeah, of course. Age keeps us from doing everything we want to do. Now, when you had your surgery, was it done at the hospital or was it done at Deuk Spine Institute?
Right here in Deuk's.
Outpatient.
Outpatient.
Yeah,
And
yeah.
I was real happy the way they treat me inside there.
Good.
I was real happy compared with the hospital. I got surgery before in the hospital, and no, I don't want to be in the hospital again. Trust me.
Did you have neck pain before your surgery?
Yes.
Did it go away after surgery?
Yes.
So neck pain can be cured.
Yeah.
There's a lot of people who think there's no cure for neck pain.
Oh yeah. My neck, basically I only can turn not even a 16, basically like this, or like my right side. Basically I can go a little bit more. Now you can see.
Much better range of motion.
Yes.
Yeah. Well, congratulations.
I appreciate it, and thank you again.
It's good to see you. Thanks for coming in.
Thank you.
And we'll see you later.